You are welcome to online tutorials with Fameternity the Schoolboy. Today we are going to take a look at dispensing. What is dispensing? Dispensing can be defined as the process of preparing and giving medicine to a named person on the basis of a prescription. It is very important to note here that dispensing is not just about handing over a medicine to a patient. It goes beyond that. It starts from the preparation of the medicine. Medicine can be prepared extemporaneously in a compounding room, or it can be formulated in pharmaceutical manufacturing firms. So by extemporaneous dispensing means that a patient is there waiting while the medicine is prepared by just combining the active ingredients and the excipients, that is other ingredients, together to prepare the medicine, and is then properly labeled, packaged, labeled, and given to the patient. While in the industrial level, the medicine is formulated by the same way, combining the active ingredient and the excipients, but in a large scale. And these are stored, well packaged, both in primary, secondary, and tertiary packaging materials, well packaged and distributed to different hospitals, community pharmacies, to distributors. Where from there now the patient or caregiver goes with the prescription, and the prescription is filled and goes home with the medicine. So this one is called prefabricated dispensing. We'll go into that in detail, but I just wanted to mention here that dispensing goes beyond just giving the medicine to a patient. The medicine need to be prepared. And it has to be on the basis of a named person. You don't just give medicine, to a person that is not named. It's important these things are documented. So the prescription should bear the name of the patient. And this dispensing should also be on the basis of what prescription is. Even though we have non-prescription medicine, yes, over the counter, yes, we have it, but generally, it should be on the basis of what? Prescription. All right, let's go. Now, a very important thing we also need to note is that dispensing also need to be carried out just to interpret the wishes of the prescriber, because the prescriber is the one that came in contact with the patient. The prescriber clerk the patient, diagnose the patient's ailment or disease, and is able to come up with the right medicine that will be given to the patient. So, as these medicines are dispensed, it should be to interpret the wishes of the prescriber. And while interpreting the wishes of the prescriber, then there should be accurate preparation. So there should be no error in preparing this medicine, and they should be properly labeled so that the patient will not make mistake using them. Very important. Now, where does dispensing take place? A very important point is that dispensing should take place in a premises that is duly approved by the Pharmacy Council of Nigeria, as far as Nigeria is concerned. Now, these premises may be a clinic, private or public. It may also be a health center, as the case of public primary health center. It can also be in hospital or even in community pharmacy setting. But the most important thing is that these places should be duly approved by the Pharmacy Council of Nigeria, PCN. Now, for a pharmacy technician, not just a pharmacy technician, for a pharmacist or anybody that is licensed to dispense medicine. These skills, knowledge of the following are very, very important. Number one, knowledge of stability of medicines and their ingredients. Yes, there is need for a pharmacist or pharmacy technician dispensing medicine to have a sound knowledge of the stability of these medicines and their ingredients. If the stability of the medicine is not known, there will be problem. Okay, for example now, there are some medicines, suspensions, that comes as powder for suspension, powder for oral suspension, for example. There are also suspensions that come as liquid form. For example, metronidazole suspension comes in liquid form. Amoxicillin comes in powder. Powder, you need to do what? Reconstitute. You need to do what? Add water and they shake them properly before dispensing. Now, or before taking. Now, what it means is that this medicine that comes in powder form before you make them to be in suspension before taking, these medicines, they are the active ingredient. The ingredient is not stable in moisture when it's exposed to what? Moisture, water. That's the meaning, that's the implication. So what it means is that if you don't have this sound knowledge of this, and you now at the manufacturing level, you now go and formulate it as liquid form, the ingredient will do what? Degrade. There will be degradation. So it cannot work. Now we now see there's need for stability of particular medicine and their ingredient to be known before you can duly do what? Dispense. All right, let's continue. Not just that alone. Another important point also is that if you don't know that this medicine, okay, now having dispensed it to a patient with the direction that you should, add water to a particular level, then shake before use. If you don't know about it, you won't be able to tell the patient to discard the medicine after 7 or 10 days, because the patient will ignorantly continue using the medicine without even knowing that it should be discarded within 7 to 10 days. So it's important to have this knowledge. Very important. Now, another very, very, very important point that a pharmacist or pharmacy technician should have a sound knowledge of the principles of compounding, not just compounding, also formulation, because compounding has a lot to do with extemporaneous, while formulation has a lot to do with prefabricated or industrial. Now, if you don't know the principles of compounding, I wonder what you are doing at level of preparation of the drug. You won't be able to do anything. So there's need for what? A sound knowledge in the principles of compounding. Now let's go to dosage posology. Tell me, what are you going to dispense? How are you going to dispense? What are you going to tell the patient if you don't know the dosage of the medicine you are dispensing? Sometimes a prescription may come, and the prescription may come. There may be an error. Yes, it happens. Medication error. It happens in the prescription. So tell me, how will the pharmacy technician or pharmacy be able to dispense if he does not have a sound knowledge of dosage or even regimen of the drug, of the medicine that you want to dispense? So that means any mistake from prescription will not be able to be corrected. So it's a very important issue and a very important point, and it is pivotal in dispensing of medicine. Dosage and dosage regimen is pivotal. It's very, very important. Apart from precision only medicines, there are some patients that may come to pharmacy or hospital. Let me use pharmacy setting as an example, to come and pick over-the-counter medicine, and there's no prescription, and you need to give the patient the medicine and tell the patient how to use the medicine. Then now tell me, without a sound knowledge of the dosage, how will you be able to dispense such medicine? So it's important that pharmacists or pharmacy technicians have a sound knowledge of what? Dosage or posology. Now, another important point is chemical, physical, and therapeutic incompatibilities. Incompatibilities abound. Some active ingredients may not be compatible with one thing or the other. Other active ingredients, some may be chemical, some may be physical, some may be even therapeutic. Now tell me, how will the pharmacist or pharmacy technician be able to dispense such drug without knowing? Remember, when we talk about dispensing, it's not just about giving the medicine to the patient. It starts from the preparation. So if you don't know about chemical incompatibility, physical incompatibility, and therapeutic incompatibility, how will you be able to, prepare this medicine? And how will you be able to give this medicine to the patient and tell the patient, don't use it with this medicine, that this will happen, that this will happen? If you don't know, you dispense it to the patient, and there will be interaction that may not be palatable. And at the end, the main purpose, the wishes of the prescriber may not be able to be accomplished. And it is a very important point that we should have a sound knowledge of the chemical, physical, and therapeutic incompatibilities. Then packaging methods. If you don't know anything about packaging, how will you be able to dispense, starting from the manufacturing level? If you use the wrong packaging material, use the wrong container, use the wrong closure for a particular product, there will be trouble. Use the wrong packaging, whether you don't know whether you should use strip or whether you should use blister packing. So, or you don't even know that a container should be an amber color because of some physical chemical properties of the drug inside the medicine package in such container. So it's very important you have a sound knowledge of packaging methods to be able to dispense properly. Now, another very, very important point is legal requirements affecting storage, supply, records, containers, and labeling of substances. These steps, these processes, they have their respective legal requirements. So if you don't know that a drug should be stored under below room temperature and you expose it, that's trouble. If you don't know about vaccine, that vaccine should be stored in cold chain, even transported in cold chain, there will be trouble. There will be trouble. So this knowledge of this is very important. The same thing, records. If you don't know that a poison, a controlled drug should be, stored in a poison cupboard, and when given to a patient, it should be properly and duly recorded in a poison book, there will be trouble. You keep having issues with the regulatory bodies, and not just about having issues with the regulatory bodies. You may enter trouble because your drug medicine entered the wrong hands. So also, the legal requirement for the container and labeling of substances are very important too. So another important knowledge is labeling procedures. If you don't know how to label, the patient will have the wrong direction, and there will be trouble, very big trouble. Either we have an overdose, the patient may take overdose of the medicine, or even subtherapeutic dose of the medicine. So these things are important. The knowledge of the following, the aforementioned, are very, very important. Now, how do we acquire this knowledge I mentioned? This knowledge is acquired by a kind of integration of different courses. During the pharmacy school or pharmacy technician training school, there are different courses. And integration of these courses help the pharmacy technician or a pharmacist to come out with a sound knowledge of the aforementioned. Now let's continue. Now, one of these courses is chemistry. Chemistry is one of the basic sciences, a pure science, but chemistry has a lot to do with pharmacy. So chemistry, from chemistry, you'll be able to know the stability studies of these ingredients. With chemistry, you know the physical chemical properties of these ingredients. That will help you to know the stability. Chemistry will also help you to know, the basic principles in compounding. If you don't know chemistry, you'll not be able to achieve that. Because it's from chemistry that you realize that mixtures is a combination of different mixture. Mixture has different components, and these components are not reacting chemically. So most in compounding or formulation, most of the ingredients, they don't react on their own, except maybe in effervescent preparation, but that one is separate. But generally, there's no reaction. They are not meant to react to form a different, product. So this is a mixture. So chemistry, knowledge of chemistry, mixtures in chemistry will help us to achieve that. Then packaging of most of the packaging in fact, the packaging materials are made up of chemicals, as synthetic products. Most of them, plastic, glass, many of them, strip, blister. So knowledge of chemistry will help you to know exactly the packaging material, how to prepare a particular packaging material, and the right ingredient, the right, chemical for a particular packaging material, and the chemical that will be contained in a particular packaging material that is not compatible with the ingredients of the product you are packaging. So knowledge of chemistry is very important. You also detect it. Also help, as I mentioned, to detect chemical and physical incompatibilities. All right, let's continue. So chemistry is pivotal in pharmacy. Very important. Pharmacology. Here in pharmacology, you look at the action and uses of drugs, medicine, as the case may be, and the dosage, therapeutic incompatibility. So without sound knowledge of pharmacology, you can never know the dosage. You can never know the mechanism of action of a particular drug, and what the drug treats, and its profile in the body. Taken from the pharmacokinetic dimension, or even from pharmacodynamic dimension. So it's very important that a pharmacist or a pharmacy technician, or in fact, pharmacy school or pharmacy technician schools offer pharmacology as a course. Very important. Then macrobiology. Knowledge of macrobiology helps to prevent microbial decomposition or degradation. It's not just about microbial decomposition. What of contamination that could even lead to, introducing a disease to the patient that is using the product? Yes, a very pathogenic bacteria organism may be introduced in a medicine because there is no check on the microbial load. And if that happens, apart from degradation of the medicine, it may also affect the patient directly by causing diseases to the patient. So it's very important. Pharmacy school, pharmacy technician training schools offer microbiology. Very important. Then pharmaceutical technology. Yes, we've been talking about dispensing, manufacturing, compounding. It's knowledge of pharmacy technology that will, expose the pharmacy technician or pharmacist to the principle that underline all the basic techniques in dispensing, like filtration, mixing, size reduction, separation, and what have you, even weighing. All these basic operations or unit operations. Pharmaceutical technology go a long way helping the pharmacist and pharmacy technician to know this. Now, forensic pharmacy. Yeah, the study of forensic pharmacy will help will help the pharmacy technician or the pharmacist to be well grounded on these legal requirements. Something like medicine storage conditions in dispensary, the condition under which a prescription can be dispensed, and the record that must be kept, and the selection and labeling of containers. These things are very important. These are what you learn in forensic pharmacy. It's very important to be able to, for a pharmacy technician to be grounded in these things. A pharmacist, or even a pharmacist, not just a pharmacy technician. All right. These are my references for this topic. These are my references. Thank you for listening. Please, if you have any question, feel free to chat me up on WhatsApp. My WhatsApp line is on the screen. If you have any question, do that, please. Please subscribe to my YouTube channel. The channel name is on the screen. From Eternity the School Boy. I have a lot of videos, lot of educating videos there that will help you to grow. Thank you very much for your attention. See you next time.